Later this week, the government is going to announce more details about its plan to increase the medical school enrollment quota. That's been frozen at a little over 3,000 since 2006. All this is part of a greater plan for structural reforms in medical infrastructure to make sure non-urban and rural areas receive quality services in essential fields. For more on this, we have our political correspondent, Lee Shi-hoo, joining us. Welcome, Shi-hoo.
Hi, Jung-min.
Hello. So why the increase and why now?
Well, it's mainly because we're seeing a lack of doctors in essential care. Let's look at some numbers. According to OECD statistics, for every 1,000 people in South Korea, there are just 2.6 practicing medical doctors. This is the second lowest figure in the OECD, which has an average of 3.7 doctors per 1,000 people. Regional gaps also exist. For every 1,000 people in Seoul, there are 3.4 doctors, while other regions in the country have 1.8. What makes matters worse is that increasingly fewer doctors are specializing in the so-called avoided practices such as heart surgery, emergency medicine, and pediatrics. As of last year, 100% of dermatology residency seats had been filled nationwide, compared to only 28% in pediatrics. The Health Ministry says the demand for medical services will only increase as Korean society ages, and so the increase is inevitable. The specific scale of the increase hasn't been announced yet.
Now, Shi-hoo, the doctors' associations are opposed for a simple increase. What's behind that?
Well, the Korean Medical Association, that represents more than the majority of doctors in South Korea, says that while they agree with the need to improve essential medical care, simply increasing the number will not solve the issue. Listen in.
The collapse of essential medical care and regional gaps that Korean society is encountering is essentially due to the avoidance of certain departments. So we're doubtful that increasing the quantitative number will improve the avoidance problem.
A doctor in practice and also the policy manager of the Korean Federation of Medical Activist Groups for Health Rights, Dr. Jeon Jin-an, says it's not the quantity of increase that matters.
Our federation agrees with the increase, but whether we increase the number of doctors by 1,000 or 2,000, doctors should be playing vital roles in essential care and at public medical institutions. If we simply increase the number this way, we may see more doctors making money running plastic surgery or obesity clinics, worsening the issue of unnecessarily distorted medical practice.
Meanwhile, the KMA is set for a meeting with the Health Ministry this Thursday, where the two parties will negotiate pending issues.
I hear the ruling and opposition parties are in agreement with the need for more doctors.
That's right. Both are in agreement and they're for the increase in numbers, but there are slight differences in their suggestions for approach. For example, the ruling People Power Party lawmaker Kim Mi-ae, who is part of the Assembly's Health and Welfare Committee, says that while there's a lot of attention being paid to the medical school quota, the ultimate goal isn't the quota increase, but building a system where more lives can be saved.
The number of patients who have died despite being eligible for treatment is 38.6 per 100,000 people in Seoul, while 49.6 in Gangwon-do. There's such a severe medical imbalance between regions. We need to build a system that allows patients in a critical emergency to be treated in a timely manner.
Kim, who's led the party task force on improving access to pediatric care, highlights that the voices of those in the field must be reflected in the process.
In terms of pediatric care, it's high risk, low return. There's much risk, but the cost is the same as the other departments. There were many voices from the field calling for change, but it was difficult to implement change right away.
Now, the main opposition Democratic Party is also forming a task force to push for the founding of public medical schools and fostering stronger medical education at existing public universities. Heading the team is lawmaker Kim Sung-ju.
Because of regional gaps, people who want better quality medical service flock to the so-called Big Five hospitals in Seoul. This leads to the concentration of medical sales and patients in the capital region. The doctors trying to practice medicine in other regions cannot survive, so they too go to Seoul. This creates a severe medical imbalance, the core problem of our current medical system.
Kim says that increasing the weight and importance of public medical services is important.
Unless public medical doctors are directly trained or regional doctor systems are introduced, it will be impossible to secure essential medical personnel. The DP's solution is not to simply increase the number, but to make sure that the government carefully controls the number and their deployment.
For example, the government could offer scholarships for medical training, and doctors would provide medical services in the region for a certain period. It's expected that talks will continue at the parliament until the details are finalized by spring to be reflected in the 2015 university admissions.
2025 university admissions. All right, it's an important issue. Thanks for the report. Keep us posted.
Thank you.